Hello again, everybody. Welcome back. This is part two, Vision and Learning Month. Okay, August is Vision and Learning Month. Now, the question today is, does this child need an eye exam? So here's the answer. I won't make you wait until the end. All children must be checked, especially in light of COVID-19. In 2000, the Kentucky Preschool Exam Law, House Bill 706, was enacted to address high rates of vision problems, severely limiting young Kentuckians' ability to learn and succeed in school. You can look at the article linked below. Now, one goal of the law was to ensure children had no significant physical or sensory impediments that would prevent them from succeeding. The bill's proponents recognized that not only do many children struggle with easily corrected obstacles to learning, but that some populations, such as Native Americans and Hispanics, are much more disadvantaged in this way than other ethnicities. HB 706 requires school officials to secure evidence that a comprehensive eye exam has been performed by an optometrist or ophthalmologist prior to January 1st of the first year a child turning 3, 4, or 5 years old is enrolled in the public school or Head Start program. The goal is that all children are ready for education and that no child will suffer the long-term effects of uncorrected visual impediments. In general, children from more informed and affluent homes are more likely to undergo vision assessment, and this leads to losses and opportunity for those affected but never tested. These unchecked visual impediments alone, it is said, account for billions in lost productivity and unneeded healthcare costs in the US every year, and the same in Canada. Differences in economic, social, and education achievement between ethnicities is also magnified by the relative differences in rates of visual impediments between them. Analysis of the first 7 years of data from Kentucky reveals that, as expected, a great number of children were identified as having significant visual impediments that had not otherwise been corrected. Correcting vision in the highest risk cases alone meant the number of Kentucky children proficient or distinguished in core scholastic success measures showed significant improvement only a few years after the preschool exam law was implemented. Children proficient or distinguished in reading rose from 57% in 2000 to 68% in 2005. Students proficient or distinguished in science rose from 36% in 2000 to 55% in 2005. Students proficient or distinguished in writing rose from 23% in 2000 to 53% in 2005. Alberta came close to achieving the same common sense approach to child development as Kentucky and other jurisdictions through near adoption of Bill 203 in 2014, something I am proud to have fought for. This bill passed second reading unanimously, then was forgotten when government changed over. It seems child health issues were of secondary concern for the governments that followed. Now, with a headlong rush to change how we deliver education to a much more computer-centric model, more than a child-centric one, more and more problems will rise to the surface in more obvious ways. Visual disturbances that impact on learning and behavior are much more likely to be encountered when the visual tasking is overloaded, such as with greater and extended amounts of near-distance digital presentation of text, with very little or no full-body development. Beyond this, computer-based instruction is just about the worst form of early childhood education, and the stats will bear this out. Kids who engage in more physical development, especially in the outdoors, are much more likely to be emotionally grounded, academically confident, and have fewer health concerns. Healthcare provides essential and advanced vision assessment service through optometry and ophthalmology. But since there is no mandate for exams, only about 15% of children are ever checked before it's too late. It is not good enough to avoid comprehensive testing saying, "This kid doesn't appear to have a problem with vision," or "Vision is not contributing to the problem." In fact, ignoring vision is logically and properly clinically categorized as child neglect, even abuse in some cases. Opinions vary on this issue, but those who work in child development, such as optometrists, vision science researchers, ophthalmologists, occupational therapists, and a growing number of teachers and psychologists, recognize the clinical facts. Some feel this is a political issue where costs to healthcare and business interests are at play. Meanwhile, for clinicians, it's clear that children who are affected by visual impediments will struggle needlessly for years and cause extra burden to public services. For taxpayers, it is a simple matter of proper resource management and cost reduction through prevention. An exam and a pair of glasses is cheaper than an MRI scanner when looking for the reason why a child gets headaches and can't read. As Canadians, we must remember also that when a child is denied strong vision for learning, he is denied a lifetime of freedom, productivity, and self-sufficiency. We are denying his rights according to the Canadian Charter of Rights and Freedoms. The day is coming when teachers, family doctors, and psychologists will have at least some notion of a child's vision needs as a basic building block of their professional training for managing their care. Vision is invisible. You have to look for it, like blood pressure or heart rate. Currently, most professional programs in child development, including pediatrics, psychology, and education, include little to no practical training in the nature of child vision, and it matters. All children must be checked. Not doing so is negligent towards the child, but also regarding the provincial and national economies. When taking your children to school, make sure they are secured by a seatbelt and make sure you know what their vision needs are, if any. Child vision exams are covered by the province. Ignoring vision needs of young learners costs us all, but the greater cost is borne by the child over a lifetime, and these costs are incalculable. The Kentucky example does provide us with a clear view of some of the many benefits to education that follow from ensuring basic learner needs such as easy and accurate vision. Now, you can expand your understanding. You can get a head start by having a look at other posts here at visionmechanic.net or on the Vision Mechanic YouTube channel. You can learn more in a formal way. You can consider taking one of the growing number of professional credit courses through PESI.com for developmental professionals, teachers, doctors, therapists, and psychologists. You can join the Vision Rehab group on Facebook. Finally, you can subscribe to Vision Mechanic on YouTube. And the links for this discussion are below.